Welcome back, guys. As most of us know, October is Breast Cancer Awareness Month, and it's important to make sure you know your status and attend regular exams, and this can all be done at UNM Sandoval Regional Medical Center. And joining us now to tell us about what they offer is Dr. Stephanie Fine, a breast surgical oncologist at UNM Sandoval Regional Medical Center. Hey,
Thank
Stephanie.
you, Rachel. I appreciate it.
Okay, so what are the signs and symptoms of early breast cancer?
Well, early breast cancer traditionally means stage 1 and 2. And a stage 1, just so you know, is about 2/3 of an inch big or smaller. So frankly, most women who have stage 1 breast cancer don't know it unless they get a screening mammogram, because you can't feel it, you can't see it, and it very often has no symptoms whatsoever. Some of the symptoms that you could look for, however, are if you feel a mass that's very distinctly different than the normal kind of lumpy bumpiness that we see. Nipple discharge can be a sign, but it has to be a specific kind. You know, if someone had a bloody nipple discharge, for example, that is a red flag. Get in to see your doctor.
Yeah.
Other things might be just a change in the appearance of your nipple or kind of skin indentation somewhere.
Okay.
So those would be maybe early signs of breast cancer.
Okay, and self-breast exams are still important, but in terms of mammograms, what about the new 3D mammography?
So you've heard about that?
Yes.
Yeah, and Sandoval Regional offers 3D mammography. Probably most imaging centers in this city do. You might see a little bit less kind of out in the hinterlands, but what that does is it evaluates especially well dense breast tissue, kind of real thick fibrous breast tissue, and allows us to find more cancers more often in those women that ordinarily a mammogram just can't pick that out. It just can't see it. So there is actually some data out there that shows that we don't have to recall people back to get more films with that modality, and that we improve the cancer detection rate. For a woman who's older and has a very, what we call fatty composition, we don't tend to need that kind of modality. They do charge a little extra for that in most, situations, so you have to kind of balance that.
Right. Okay, so I know you have a quote, but what is the power of wearing pink?
Okay, so I don't normally follow or quote lots of football players because I just don't follow the game, but I love this one by D'Angelo Williams, who's I think Steelers football player. And his mother had breast cancer, and he wanted to wear more pink on the field, and his coach was sort of not allowing that. So his statement was, pink is not a color, it's a culture.
Right.
And I love that.
It's true, too. Think pink.
Because it really makes a statement. It's a way to make a statement without holding up a sign saying, here's my vote. But you are making that statement to community leaders, state leaders, federal leaders, that you care about it.
Right, exactly. All right, so doctor, where can we get more information?
Some good websites would be, UNM obviously has a top-rated cancer center, so cancer.unm.edu is one. The American Cancer Society has cancer.org as their premier website, very informational. Sandoval Regional has a separate website, kind of maybe more to find, local providers.
Thank you. And as always, thank you so much for coming in. And for more information on UNM Sandoval Regional Medical Center, just head to casa.com. But for now, we're going to head things over to